carnival. My backbone hot in me, my knee bone hot in me, my shoulder hot in me. Look how I walking funny. My backbone hot in me, my knee bone hot in me, my shoulder hot in me. Look how I walking funny. My backbone hot in me, my knee bone hot in me, my shoulder hot in me.
Welcome back to the Now Morning Show on this Tobago Thursdays, and we are going to be featuring a very, very interesting topic for this segment. Now, on today's episode of Your Body and You, we will be looking at headaches, a common occurrence that can be caused by several factors, including stress, diet, and even medication. And so to help us in identifying the types of headaches and how to deal with them is the founder and director of Emerald Health and Wellness Clinic, Dr. Kerly-Ann Tobias-Joseph. Doc, good morning. Thank you so much for joining us on Now.
Hi, good morning. So happy that you have me on this morning.
Yes, and I know it's not your first time, so thank you so much for joining us again.
Sure.
Now, let's get straight into it. Common causes of headaches. Can you tell us what are some of the common causes? Like, I know we mentioned stress, diet. Is it usually those type of things that cause it, or can we see other factors as well?
Listen, there are so many things that can cause headaches, and I'm so happy that you mentioned those. And when we talk about diet, we are a lot of times speaking about food and sensitivities, like cheese and chocolate, those kind of things can trigger headache.
Yeah.
MSG is a great part of our diet, and that can cause headaches as well. There's also the lack of water, so dehydration can cause headache. And a very common thing in our culture, a lot of alcohol use can cause, a little hangover.
Yes.
But there are other things as well,
Yeah.
So, for example, we are just coming out of flu season. So having a flu or a little viral infection can cause headache, sinusitis, you feel really congested. And really and truly, when we speak about headaches, there are really two classifications. There are primary headaches and secondary headaches, right? So a primary headache would be like something that is caused primarily by the head. So you have a cluster headache, a tension headache. But there are secondary headaches which are caused by other things like infection, as I mentioned some before, a tumor, or even an injury.
Yeah.
And there are little things that persons can check for, You want to know, well, were you eating on time? Have you checked your blood pressure? Because if it's elevated, it can cause your head to hurt. Having a toothache,
Oh, those toothaches are brutal.
Listen.
Yes. Yes.
Yeah.
Yeah.
And then normal little things in life that are just a part of our lives, for example, as women, having our period, can actually cause a migraine headache as well.
Yeah. Now, Doc, right, and I'm glad you mentioned migraine, because I know that some people, you may get the random headache, whether it, as you were talking about it, your diet, maybe heat, because I know sometimes heat can cause people to get headaches as well.
Yes,
but what about those with migraines? I mean, when does it get clinical to the point where this is something that you have to live with over time?
Well, the thing about migraine is that they are usually triggers. So each person who has migraines needs to know their triggers. So your trigger might be not eating on time. So it's very important to make sure that you have your meals in a timely fashion, and definitely avoid the triggers that for example, as I mentioned, cheese, chocolate, MSG, being dehydrated can trigger a migraine, or even being under stress. So there are the things that you can avoid, but I don't think there's anybody who can really avoid their period.
Right. Well, we haven't reached that far in research as yet, but we'll see.
We'll see. But one of the greatest things about a migraine, once you know that this is, you've gone to your doctor, you realize that this has been a recurrence. One of the things that you need to know as soon as you feel that migraine coming on, and it may feel like a band-like feeling or a pounding, light and loud noises may bother you.
Yeah.
You may feel dizzy. What I would suggest is you want to start taking something. Try to stop that headache as soon as you can, and you find that that's the easiest time to stop it. Once you let it linger until the next day and another day, it's really, really difficult to get rid of it.
Now, I also wanted to discuss, Doc, as well, some of the things that you can use to sort of alleviate the pain that you get from these headaches, right? So, of course, we have the sinus pills that you take, and there are different brands. There are a variety of them. But what we've been seeing coming out more now, so are some wellness options. And so I was reading about something with the pressure points, that there's certain pressure points you touch on your body that can help you to alleviate the pain. I mean, is there some validity to that?
Well, sure, because remember, stress is one of the things that can cause some of this pain, and which is why I think it's so important that persons be attentive to what is causing the headache. Because you may think that you're having a pain and, I probably just didn't sleep, I just didn't drink enough water. But what if you're having a stroke? That's why you need to check your blood pressure. So as much as there are natural things that you can do, there are things that you want to look out for to be able to know, all right, what type of headache might I be having, things to pay attention to know what to tell your doctor, and your doctor would be very helpful in helping you diagnose what kind of pain, and then letting you, you can choose your treatment options. The doctor would give you options. So I have no problem with the natural things. For example, magnesium. Magnesium is a great relief, if you're having a tension-type headache. It can be helpful with migraines, and if, some persons have neck injuries, maybe they had a whiplash injury sometime before,
right?
And that can actually cause headaches, and magnesium can be helpful with that. But how do you know what type of headache you're having?
Well then, Doc, let's look at that. Because so you mentioned, things to look out for. What are some of the things we should look out for us to know? All right, for example, is it something I need to deal with at home, or do I need to go and get an additional person to probably prescribe me something? How do we know what to look out for?
All right. So the first thing is, where are you having the pain? And that makes a difference. Because like a cluster headache, for example, can be, centered around the eyes. You may have redness and tearing of the eyes, a bit of nasal congestion, and it is described as, amongst the worst pain that someone can experience. So where is it? At the front, at the back, at the side? What is the intensity of the pain? Is it just a 1 out of 10, 10 being the greatest intensity, or is it a 9 out of 10, quite a severe headache?
Right.
You would want to know what is the quality. So is it like a pounding feeling, like what you'd have with a migraine? Or is it a band-like tension? Those things are important. Did it start suddenly or, coming on gradually? Does it move to go anywhere? And does anything make it better or worse? But I think the greatest clincher for headaches is what are the associated symptoms. And there are quite a few associated symptoms that you can have. For example, neck pain,
right,
or stiffness, fever or runny nose,
right,
nausea or vomiting. And nausea and vomiting is usually a signal you need to go to the doctor. If you're having nausea or vomiting, you need to go see a doctor. Dizziness or blurred vision, and definitely if there's any weakness or slurred speech, this is a definite indication that this is an emergency, because you may be having a stroke.
And
right?
Doc, quickly before you go, just give us some tips that we can use now. Like I understand that you're saying that maybe if it gets too consistent and persistent over time, you may need to go to a doctor. But it's late at night, you have no ibuprofen. Are there anything you can do at that point in time to sort of ease the pain of those headaches?
All right. So the first thing you'd want to know, did you eat on time that day? Were you drinking enough water? Were you getting enough sleep? The simplest thing that you can do at home is, first thing, check your blood pressure. And if, those basic things are okay, it's not just as simple as drinking more water, you can just start with a simple Panadol, There's Panadol Ultra. These are little things that you can do to see if the headache responds. Any triggers or things that that you haven't done right, you want to address those. But definitely once you realize it's something you cannot control, you've tried relaxation techniques and all like that, you can't control it, then you seek medical attention the next day.
And Doc, quickly, you mentioned magnesium. Is it, how would you take that for a headache? Is it something you mix? Is it a pill that you have to buy?
Yeah, it's actually available over the counter. You can get a 400 milligram tablet of magnesium.
Right.
Because magnesium really relaxes you, I usually tell patients it's better to take it at night.
Right. Okay, just wanted to confirm that. Well, Doc, thank you so much for joining us this morning. I know that we could go on and on, but I'm sure that the tips that you shared with us will be enough to help us ease the pain of those headaches. So thank you so much.
You're most welcome. Have a great day.
Have a good one. And that was founder and director of the Emerald Health Wellness Clinic, Dr. Kerly-Ann Tobias-Joseph, just giving us some tips on how to deal with those headaches. You're on the Now Morning Show. We're going to take a quick break and be right back. Stay with us.
My knee bone hot in me, my shoulder hot in me. Look how I walk in funny, my backbone hot in me.